the Spinal Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, or Dr. Cowboy Slater. Caleb Slater, Dr. Cowboy Slater, and here with Fat Harry Potter.
I'm a wizard, okay?
So today's Halloween episode is scary versus not scary. What are scary symptoms and what are not scary symptoms? And there's a lot of symptoms out there that people are told they sound scary, but they're not. But then there's some symptoms that people are not aware of, and they are very scary. So, Chris, as a lay wizard, what are some medical symptoms that to you are scary?
Well, I think initially any kind of pain that isn't resolving starts to be scary.
So, and all right, let's qualify that a little bit. Because pain in and of itself, pain is bad, right?
Sure.
But pain is your first response.
Right.
You know? So, and I say this a lot, like if I put pressure on a nerve and it hurts, you pull away. You know, if you grab a frying pan and it's hot, you let go, right?
Yeah.
It's your initial quick response. If there's enough pressure, if you can alleviate that pressure and it stays there, eventually that tissue will damage over time. And specifically for a nerve, that damaged nerve goes from pain to tingling to numb and then eventually weak.
Yeah.
So although, you know, pain, I don't want to be in pain, but physiologically speaking, pain is actually better than numbness or weakness.
Yeah, and it almost feels like you would think maybe the opposite would be.
Right, because it doesn't feel as bad.
It doesn't feel as bad, exactly. So, but there is obviously an element to, if I'm in pain, and I guess it's the varying levels of pain, right? If it's just a minor pain, how many people deal with minor pain all the time?
Right.
And okay, so I'll take Tylenol on the day where it's worse or whatever, or Advil or something to numb those symptoms. But otherwise, I just adjust my movement and I go on with my day.
Well, and when we're looking for, let's say, scary symptoms, right?
Yeah.
The first thing that pops in mind is
what, like
cancer.
Oh, yeah, of course.
So maybe how would pain indicate cancer?
Well, if you have any sort of pain and you Google what the pain is, it will
cancer.
immediately tell you you have cancer.
You know what? I actually meant to bring this up because in school, you know, when you're going through PT school or medical training, I would say 1 out of every 2, and maybe I'm being a little hyperbolic here, but it's so many of like the case scenarios that you get or test questions that you get.
Yeah.
It's cancer.
Cancer, of course.
It's cancer. It's refer back. It's don't treat. In real life, that is absolutely not the case.
No.
But there is a type of pain or maybe a presentation of pain that might point you towards cancer.
Okay.
You know what it is?
No, because I don't want to know that I have it.
You don't want to know? You know what? And this should actually make
it?
most people happy out there. It's pain that's unchanging.
Oh, so it doesn't vary in its...
Doesn't vary. It doesn't matter what time of day. It doesn't matter what you eat. It doesn't matter what position you're in.
It's just there.
For the most part, it's pretty much there. And here's one that this feels weird to say that I like to look for or see. It's pain that doesn't respond to treatment. So especially around about 4 weeks of treatment. So one of the worst things to see for patients that I'm working for them is their pain isn't changing, no matter what I do. And I troubleshoot, I change directions, I change treatment methods, and their pain is still there. Now I'm starting to think space-occupying lesion, like maybe a cyst, a tumor, something like that, a fatty lipoma, but either way, something that might need surgical attention or more.
Gotcha, yeah. When you say it doesn't change at all, would it change if you took some sort of over-the-counter pain relief?
Minimally. So you know, it might minimally change. Time of day might minimally change. You know, what you eat or position you're in, it might minimally change with medication, but not. It won't go away.
Right.
For the most part.
Yeah. And like, it seems very obvious that if you're dealing with a back problem or foot problem or leg problem, whatever, when you move, you notice a difference generally. And if you never noticed a difference, that would be very concerning.
It's just, constantly there.
Yeah, I've obviously never experienced that. Hope to never experience it.
And I'm not saying it is cancer if that's the case.
No, but it's something.
But it's something
out.
It's something that now you take it more seriously.
Okay.
And it's specifically for me on my end, if it's failing to respond to treatment.
Okay.
The problem there is that the treatment could be wrong. You know, you could be getting your elbow treated, but it's actually coming from your neck, right? So you have to be a little careful about that. But that's definitely one of the symptoms that you look for.
Okay, and that is, would you rate that as one of the scariest symptoms?
No.
Really?
No.
Okay.
Because of that, because A, you know, maybe you're getting the wrong area treated. You know, B, a lot of times when people say it's always there, then you start questioning them, like,
and then
was it there right now?
Story breaks down.
Yeah, you're like, well, what's your pain right now? Oh, I don't have pain right now.
Yeah.
I'm like, oh, all right, well, that's not
Not
always.
always, yeah.
Yeah, and I would say that's probably the most common when patients, oh, it's always there. Well, you know, what's it right now? Or, you know, is it there in the morning? No, in the morning it's fine. Like, okay, well come on.
Well, yeah.
It's not always.
Okay. All right, so there's one. If it's painful all the time.
Painful all the time, not changing, specifically with treatment or some intervention that you've given 3 to 4 weeks of an attempt.
Okay.
Now you're starting to think, all right, I want to look at this more in depth.
Gotcha.
All right. Do you know another scary sign?
What about a chronic pain that constantly keeps coming back? Now, not constant in
But
its
it just keeps
field,
returning.
but like keeps returning in its intensity.
No. No,
That's not something?
No, because
that would be concerning to
most
me.
back pain, actually a lot of symptoms are episodic, right? Like,
True, yeah.
Most back pain is episodic. You get it, it goes away. You get it, it goes away. We talk a lot about like Crohn's and ulcerative colitis. Those are known to have remission, right? It goes away. A lot of conditions out there are on and off. On and off actually tends to mean better. On and off means, specifically, talking about orthopedic, on and off tends to mean that there's something that you can do to address it.
It's lifestyle stuff.
Yeah, well, so
generally.
I like to hear that from a patient when they come in. I like to hear that, and they're often confused by it. Like, yeah, I don't know what. Like, one day I play tennis and my arm's fine. The next day it hurts, and I don't know what's going on. To me, that means it's treatable.
Okay. What if you're getting...
So not scary.
Not scary.
We're labeling.
Bam.
If it changes, not scary. We should have had like a audio effect here.
Well, we can do it in post.
Yeah.
We're not going to.
No, but we could.
We could.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
What if you're having like extreme, like a stabbing pain that doesn't last but is intense?
No.
Have you ever had anything like that with your back or anything like that?
Yeah, random, pain, stuff like that. Yeah. No, I'd still say
That's not a scary. That's
No.
not something that should be like overly concerning.
And again, when we're saying scary, we're talking about, the difference between a sprained ankle, meniscus issues, arthritic pain, tendon degeneration, all of that not scary pain, right?
Okay.
And all of that can cause stabbing sensation. Now, like you're getting a stabbing sensation in your chest, and your left arm is heavy. Now we're scary again, right?
Yeah.
But in general, again, for pain, specifically for pain, if it's unrelenting, can't change it, now you're worried. Besides that, obviously pain is bad, but it's your first sign.
All right.
So typically pain is less scary.
All right. So then we move on to.
Well, how about some maybe like diagnosis that people would give you off of an image? Or any of those stick out to you as scary? Like what if I told you have
like
a herniated disc?
If you told me I had a herniated disc or spondylolisthesis or something like that, it sounds like my back is broken.
It does. And are
Structurally,
they scary or not scary? Not scary. Not scary.
Did you say that as magic?
So if you took, we say this all the time, but we'll say it again. If you took a bunch of 40-year-olds off the street, no pain whatsoever, and you image them, it would be rare for you not to be able to find something on that image. And that finding would be degenerative disc disease, a herniated disc, spinal stenosis, spondylolisthesis, right?
Yeah.
Spondylolisthesis would be more rare than all of those other ones, but still.
Yeah.
But even like the spondylolisthesis, you'd be more common in like a 60 or 70-year-old. Often that's a degenerative change over time. It's a stable condition for the most part. It's not scary. These are natural changes that happen in your body, just like gray hairs and wrinkles. The same changes happen on the inside.
Yeah.
Now there's stuff that you can do to improve or worsen it, and a lot of it is sedentary, not moving. That worsens a lot of these conditions or the pain that you get from them. But those symptoms aren't scary, even though they sound like it, because they sound like you're broken.
Yeah. Oh yeah, for sure. So as you get older, your appearance changes. Gray hair, your skin sags and stuff like that. Is this just kind of a similar aesthetic change to your back? Or if it's not quite that, can it cause problems though?
It can cause problems. Yeah, I'm not saying.
Yeah.
I'm not saying no degenerative disc causes problems, no spinal stenosis causes problems. They can absolutely cause problems. But what people need to know is that they can absolutely and are absolutely there without causing a problem whatsoever. So you have to be careful about going down the rabbit hole of treating a condition that would be there in the first place. And the problem is that all these treatments, the medication, the injections, the dorsal column stimulators, the nerve ablations, all that stuff doesn't treat the problem. Anyway, it just numbs you to your symptoms.
Yeah. Okay, so but how do you screen then because if I can go and get an image and it shows that, what's the alternative?
You have to listen to the patient's symptoms. You have to listen and know what to look for. And that's kind of what we're trying to get out there right now is what would be scary, versus not scary. And I would say basically every patient I treat has multi-level degenerative disc disease, multi-level herniations, spinal stenosis, chronic pain. I don't see anybody that's at this stage, that's healthy and they just, tweaked their ankle or something like that.
Gotcha. So you would label this as not scary.
Not scary. All right, let's get a scary one.
All
right. Do you know what saddle anesthesia is?
No, it doesn't sound good though.
So it's lack of sensation in your saddle region.
Like your butt?
Yeah, like if you were to sit on a saddle,
okay,
the area that'd be contacting the saddle.
Yeah.
Lack of change of sensation in that area.
So like a numbness feeling or
numbness, tingling, maybe pain distribution in that area.
Okay.
A lot of times it occurs with changes in bowel or bladder habits.
Okay.
Specifically feeling like you can't fully evacuate your bladder.
All right.
Now we're talking scary.
Really?
Yeah. These are signs of Cauda equina syndrome. This can be a medical emergency. This needs to be further fleshed out.
How do you what's the differentiation between just you sitting too much in a chair?
Well, I mean,
getting like that lower back pain.
Get up and move.
Oh, so if you get up and move though, with this, would you still feel the sensation?
Yeah, very likely.
Okay.
Yeah, very likely the saddle anesthesia, it's relatively constant.
So it's not like I've been sitting in the chair for a while and my butt's
it's not like your
numb.
butt's numb.
Yeah,
No,
it's like
if your butt's numb and you get up and walk and your butt's not numb.
Yeah.
Now
you need to get your butt up more.
You're just a fat Harry Potter that didn't get up, and
yeah, that would be crazy.
Yeah. Expelliarmus.
So how do you get that though?
There's a bunch of different ways.
Okay, it's not just. Is it something that just comes on? Is it?
It can.
Okay.
A space-occupying lesion like a tumor can cause it. Trauma can cause it.
But it's coupled with the bowel movement issues and stuff like that.
Not always.
Not always.
So any one of those symptoms, scary. Let's say you're just having a change in your bowel and bladder. You're having trouble completely evacuating your bladder, scary.
Yeah.
Let's say you're just having the saddle anesthesia, changes in the sensation in that area, scary. Even if you don't have the bladder or bowel changes.
Okay, so if you're having that, that's the time to go to the doctor.
That's time to go to the doctor. Yeah,
Right.
go to the doctor. Maybe even go to the ER. That's you want to be seen. You want to be seen as soon as possible.
Okay. All right, that's a scary one.
We got a scary one. All right.
Yep.
Can you give me another one that you know as a lay person or a lay witch or wizard?
I'm a wizard. That is scary?
Yeah. Well, just that would freak you out.
Well, I don't even know if this is a thing, but a sudden numbness or something like that in an appendage or a leg or anything, just something that comes on.
Yeah, it could be. It's kind of
it would feel scary to me.
call it like a yellow light.
Okay.
It could be. A lot of people get numbness though, specifically when they're like reading in bed. A lot of people wake up with numbness in their arms or like the inability to like really strongly grip something in the morning.
Yeah.
Those aren't scary symptoms, but those are a sign of, hey, you need to do something to fix this. You have a problem, but this is normal spine nerve problems that a lot of people get because we constantly sit, look down, look at our phones, read. Like, if you just know what to do to undo that, those symptoms will change and change relatively quickly.
I think there's an element to, and just speaking as a layman, but like losing the strength of anything like that feels like am I moving towards like being paralyzed in some way? Is the fear at least?
Yeah. So again, like waking up in the morning with your hands numb, tingling, weak, scrolling on your phone and your hands going numb. These are signs that you have a problem with your spine, with your nerves. Absolutely, but they're not scary.
Okay.
So, not scary.
All right. What about anything to do with your brain?
Okay. So, and how would that present, right?
So, yeah.
One of the big ones is a change in the way you walk. So the term would be gait ataxia. Mm-hmm. But basically what it means to the lay person or the lay wizard, trying to stick with the Halloween theme here.
Of course.
You look clumsy when you're walking. Looks like you're a newborn fawn trying to figure out your legs.
Yep, I know what you're talking about.
If you see that, scary.
Okay.
That could be a brain issue, but it could also be a central spinal cord issue.
Okay.
Okay, and those need attention.
So is that something that comes on sudden as well?
It can. It can come on sudden. It can come on kind of slowly over time. It depends on, if it was trauma, if there was some instability, or if it was just a gradual degeneration that was closing down on your spinal cord.
Yeah.
If, obviously with the brain, if it was a tumor or a change in like pressure on the brain, those changes can occur specifically on like the cerebellum. Mm-hmm. But yeah, so it can come on suddenly, it can come on gradually. Either way, you start, and a lot of times what happens is patients, if it comes on gradually, it's kind of like that whole, a lobster in a boiling pot doesn't realize it. So just, just using that analogy, it's kind of the same. They're just like, oh, that's just the way I walk. And you're like, no, that's not. Often it's your loved ones that'll start saying stuff.
Yeah. Any kind of pain behind the eye, I know, can be many things,
it could be a headache.
It can be concerning.
Yeah, I mean, every time I get a headache, I'm pretty certain it's an aneurysm.
Yeah, it's there's that huge tumor right behind my eye. You've
ready to go.
Before.
Yeah, headaches are tough.
Yeah.
Facial pain is tough because, it can absolutely be, a stroke and aneurysm. But most of the time, most of the time it's a spine issue. Most of the time, there's a relatively large area of your spine that can cause facial head and neck pain. Muscular imbalances can also cause it too. Dehydration. If I drink a bunch of coffee and I'm not drinking water, I'll start to get a headache. And so headaches are tough. Facial pain is tough because it can absolutely be. All right, actually a good one. Tic douloureux. right? You've heard of that?
Is that your favorite spell you use? Like, what is this?
That is. Well, I'm not a wizard.
True, you're a cowboy.
I'm a cowboy.
Sorry, I forgot. Tic de la Rue?
Tic de la Rue.
Okay.
Trigeminal neuralgia.
Okay.
Right? You want to double check that for me?
Never heard of this.
It would be pain in like the eye or face, unlike you've never felt before.
Like extreme pain.
Extreme pain. Like so they call it suicide disease.
Because it's so painful.
It's so painful you want to kill yourself.
Oh my God.
That's a scary.
Can it be resolved?
It can be, but you want to get that treated. and
it's-
it could very likely be surgery that needs to be done.
Okay.
Scary.
Scary.
So pain unlike you've never felt before, in the face, specifically on one side, by the eye, scary.
Scary, yeah. Well, that sounds...
Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult within 30 minutes. I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
Sounds like, yeah.
Sounds scary, yeah.
Scary.
That one sounds like, hey, but you'd be surprised. I'm constantly surprised on the symptoms that patients care about and don't care about.
Yeah.
And maybe it's because, again, as a layperson, pain is really what you care about.
Yeah.
But there's so many other ones that like again, not being able to completely empty your bladder, that really doesn't sound that bad. So I'm just peeing a whole bunch, right?
Right.
I pee and then I'm like, I got to pee again, and like, I got to pee again. And I'm not saying that in and of itself is scary, but it's a sign that you want to get checked out, right? Because it could be a few things. If you couple that with saddle anesthesia, now it's a scary sign.
So what if, and maybe it's not you, but you observe in like your parent or someone who's older in age that they seem like they're a fall risk, or that they can't walk, they don't have great balance?
Yeah,
because isn't like a fall risk of a large sign of...
Well, I mean, it's health. So that's why you'll hear a lot of this, like quad strength, or leg strength, however you want to phrase it, is a strong predictor of longevity of life.
Okay.
Largely because of that. Remember, like if I have good leg strength, I can get in and out of a chair easily. So A, I'm more active.
Yeah.
And B, I'm more stable on my feet, so I'm less likely to fall. Probably have more muscle mass, which helps with bone density and general metabolic health, right?
Yep.
So I wouldn't say a fall risk is scary. I'd say it's normal.
Okay.
So I have a friend who just got open heart surgery at an early age. She's late 30s.
Okay.
Okay. She's now going to cardiac rehab. She is by far the youngest person in cardiac rehab. The thing that she brought back with her that she was like so surprised about was how many people there are driving to cardiac rehab and from cardiac rehab that shouldn't be driving.
Yeah.
When you're working with that population, it's scary, not to them, but to you, because you're going to go get on the road.
In real, yeah.
And so
all these 70-year-olds.
Unfortunately, like it is just common. You lose your balance. You kind of revert back to like, when you're a 1-year-old learning to walk and you just fall down and people are like, oh, it's normal.
Yeah.
Like, this is normal, but obviously it's a bad thing because if you can fracture a hip and then that becomes, not to be cavalier about it, but that can become a death sentence where you're in bed, you're more likely to get a pressure ulcer, a blood clot, or an infection, something like that.
Do you think is there something you could do as you get older in age? Like,
the short answer is just continue to be active. And move in different positions. Continue to do strength training.
Gotcha.
Like that. That's what you can do to prevent that, or I should say to lessen it.
Gotcha.
All right, so we need another scary one. So balance in and of itself, especially coupled with age, not scary, but maybe at a younger, so let's say there's no reason for it. Let's say you're under 60.
Yeah.
Let's say all of a sudden you're starting to have some clumsiness,
Okay.
in your hands or feet. That one's scary. Yeah, that one, it goes back to what we were talking about. It could be a brain issue, specifically
Neurological.
cerebellum, could be neurological, but it could also be neurological in the spine as
Okay.
well. So there's a difference between like your spinal nerves and your spinal cord. Your cord is like the tree trunk.
Okay.
If you get pressure on the tree trunk, you have symptoms like gait ataxia, so clumsiness, change in balance, stuff like that, weakness in the extremities, drop attacks. Okay, so like, and that should be an obvious one, right? If you're just dropping on the floor, that's a bad thing.
It's probably not good.
So if there is clumsiness, changes in balance, and you're under 60, now scary.
All right. What if you're having breathing issues?
It's a little bit of a mixed bag, on what type of breathing issues does it change. So, because and we've interviewed this person. I have a chapter in my book about asthma. We've had a bunch of patients and we're using asthma as the term that they were given, but it was breathing issues, either pain or restriction or both, and it was actually a spine issue. Just either a muscle imbalance or limitations in their spine or putting pressure on a nerve or a combination of them that led to these breathing changes. And they're not scary, they're fixable.
So it could be a scary thing, it could not possibly not be. It kind of depends on a few factors.
Could depend.
Yeah.
Yeah. I'm trying to think of a few other scary ones.
Just to highlight what you had talked about ALS with
Oh, voice changes.
being younger
Voice changes.
and noticing.
Voice changes, yeah. So
Okay. Didn't even know that was a thing.
difficulty talking or swallowing.
See, I hate talking about stuff like this because then in my head, I'm like, well, that's me.
You're having
I
trouble
have that.
swallowing
I can't
right
even
now?
swallow. I've never swallowed before.
How do you even swallow?
I don't even know how
Yeah.
to swallow any. That's
Yeah,
what
now
I
I
mean.
have to think, swallow before I
How do
talk.
I breathe? Am I breathing?
Yeah.
Yeah, exactly.
So difficulty talking or swallowing, this can be a medical emergency, or it's something very serious to get looked at to figure out why. It could be something as simple as just chronic acid reflux is changing it, or it could be something as severe as a tumor or spinal cord change in your cervical spine, in your neck. So if there's a disc pushing on your central cord, your spinal cord, if there's a tumor, it would likely lead to voice changes, difficulty swallowing, hoarseness.
Okay. Where you become a horse.
Yeah.
In the similar vein, what about like tinnitus or something?
Ringing in the ears.
Like a ringing in the ears?
This is another mixed bag. It
Yeah,
can
I
be
figured.
a tumor on I'm
Right.
pretty sure it'd be the temporal lobe.
Yeah.
But it could be, we see patients that have ear fullness, ear ringing, and you treat their neck and their
It's just a
symptoms
neck
go
problem,
away.
yeah.
So that can be a mixed bag.
Okay.
Red flag if accompanied by sudden hearing loss, vertigo, discharge in your ear, facial weakness, hearing your heartbeat in your ear, and a history of trauma and severe infection.
Yeah, but so it's a lot of ifs.
I've definitely heard my heartbeat in my ear before.
Sure. What, you ever lay down on a
Exactly.
pillow in a quiet room?
Exactly,
And you're
you
like,
can hear
you're
it.
like, God damn it, I'm listening to my heart right now, and now I
Yeah.
can't get to sleep.
And
'cause-
then it stops for a few seconds,
Yeah.
and you're like, well, I guess I'm dead.
yeah, you can hear like the whooshing. Yeah.
Usually not immediately dangerous.
Yeah.
Okay.
So yeah, I don't want to say not scary because it can be a bunch of different things, but probably not scary.
What about any kind of vision change?
It's going to be another mixed bag.
Yeah, everything up there.
Well,
yeah.
not everything, right? Like saddle anesthesia, changes in
Sure.
bowel and bladder, like those are, and again, they could have non-scary reasons, but these are scary symptoms that you want to get checked out,
Yeah.
right? Like vision changes, it could be a bunch of things.
Yeah.
Yeah.
All right. Well, let's move to some of our like extremities though. Like if I have wrist pain,
It's not scary.
not scary.
It's not scary. Yeah. At
Treatable.
all. It's most likely your neck.
Most likely your neck. If I got, let's say I got plantar fasciitis or some sort of foot pain,
Not scary.
not scary.
Not scary at all. It's plantar fasciitis. It's Morton's neuroma. It's a bone spur, or
All
more
treatable.
likely, it's your back.
By back, sciatica.
It's the sciatic nerve. A lot of people don't realize the sciatic nerve is what innervates the bottom of your foot. It's what innervates the plantar fascia. If you have a sciatic nerve problem, you can have the same symptoms as plantar fasciitis, bone spur, Achilles tendonitis, tendinosis, tendinopathy, Morton's neuroma, whatever.
Okay.
A lot of people, they've slept wrong, so, quote unquote. You know, they impinged, they pressed on a disc overnight, which then pushed on a nerve, or they pressed on a nerve overnight, which caused that pain. The muscle spasm then occurred, and now all of a sudden you feel like you can't move.
Yeah.
I'd probably label it not scary, looking at it, I would think it's normal musculoskeletal symptoms.
I've definitely experienced where I wake up and it's like, oh, this is how I move now. My neck doesn't turn.
Yeah.
And it's like a few days and doing a few things, whatever, it's back to normal. But it isn't necessarily scary, but it's like noticeable.
Yeah. And again, it's scary to you, but in the medical world, not scary. And this might be a good one, because this is, I think, going to be one of our next week's talk. But let's say you wake up and all of a sudden, in either two areas of your body, one your neck, you're like just bent to the side and a little twisted, and you can't do anything about it.
Yeah.
So that would be cervical dystonia, right? It's torticollis is another name for it. Or with your lower back, you're shifted to one side and you don't know why.
Gotcha.
So those are both a shift. They hurt often, especially the back.
And that comes on sudden?
It comes on sudden.
Oh,
It
wow.
can come on from, you could wake up like that.
Yeah,
Come
that
on
would be
from a
scary.
sneeze. You could roll out of bed. You could pick something up, and all of a sudden you're shifted. And it normally comes on sudden. It normally doesn't come on gradually over time.
And should I be scared?
No. No, it's very treatable. It's scary in the moment for the patient.
Yeah,
But
sounds
again,
scary.
like if somebody walks into my clinic like that, I'm not scared. I'm a little, I don't want to say annoyed, because they're more, not harder to treat or more annoying to treat, but they tend to take a little bit more time, especially if they don't get to you right away. Put it this way, like if I'm shifted over, like my shoulders are moved on my body and I'm shifted like that, if you come to me that day, great, we'll get you back. If you come to me a month from now, now we're dealing with compensatory changes, right?
Yeah.
Muscles, tendons, ligaments, fascia have elongated on one side, have shortened on another. It's harder. It takes a little bit more time to recover.
And what if I come to you 5 years from now with that?
Same. And sometimes they still respond right away, but more often than not, if it's chronic, it takes a while.
Okay. What about if I'm having shoulder pain, my frozen shoulder or something along those lines?
No, again,
scary?
speaking like it's primarily an orthopedic problem, not scary.
Okay. I think that the scariest stuff to me seems like when I feel like it's an organ, a specific organ or something like that,
Okay.
or in that area.
How do you feel?
So the reason I say that is because like when I was having gallbladder issues, it wasn't represented as like internal completely, but it felt like back pain,
Yeah.
strong back pain. So I don't know if that would be similar to like something that isn't the gallbladder, do you know what I mean? But like where it was like an immense back pain in the middle of my back.
And I always get this wrong. The gallbladder refers to one shoulder versus the other, and
Yeah.
Is the split-
It's a gallbladder tenderness in the right upper
Yep.
abdominal area, Murphy's sign with the kidney.
that was spleen to the other shoulder. So your visceral system can refer to your joints.
Mm-hmm.
So it can be a little hard to tell. But yeah, in general, abdominal pain, that's not going away.
Scary.
It needs to be looked at.
Yeah.
It needs to get some attention sooner rather than later. There's a lot of abdominal pain and symptoms that they're not scary. It's not a scary cause, but regardless, you need to get it looked at.
Right, sorry, I have it. Gallbladder, the right shoulder blade or upper back.
There you go.
Between the shoulder blades.
Yeah.
Sometimes the right scapula.
Then is spleen left?
Let's see, spleen would be left upper abdominal area, left shoulder.
Okay.
upper
You're a spleen man.
side,
Yeah,
Left upper back.
I got that. I normally mix them up.
It's all right. I just knew from experience, having had my gallbladder removed, where the pain was coming from.
No, but like which shoulder it can refer to.
Oh, I got you.
Yeah,
Got you.
'cause
Got
you
you.
can have, so your organs can refer
Yeah.
pain. Just like your spine can cause pain into your knee, your gallbladder can cause pain into your shoulder.
Gotcha. Any others that you can think of?
Not off the top of my head, adjusting my cowboy hat here.
See what you did there. What about treatments? Should is a cortisone injection
Ooh,
scary?
okay, I didn't think about this. Cortisone injection isn't scary. Most of the treatments out there aren't scary. They're mostly unnecessary. Cortisone injection, pills, facet injection, epidurals.
Just knowing that, hey, this cortisone injection isn't fixing anything.
Yeah, right.
It'll alleviate some pain temporarily.
So it's more scary to me than it maybe to the patient. I'm sure the patient that day, but they're looking for relief.
Yeah.
For me, I'm looking at them thinking, you're numbing your symptoms and now you're going to go do stuff.
And progress your issue.
Something's
Yeah.
going to happen here.
Yeah.
A nerve ablation, to me, and it should sound scary, and it's largely unnecessary, and it's largely ineffective. But a nerve ablation is a thermal or chemical destruction of the nerve that they'll do. They can't figure out how to treat your pain, but they can figure out what nerve is attributing to it. So they destroy the non-motor portion of the nerve in order to basically make you stop feeling your symptoms, not make the cause go away.
If only they could do that with my emotions.
Right? but for me,
that is scary though.
Why do that? I
mean, if you're desperate to
I shouldn't say why
pain,
do that. I
it
get
makes
there's
sense.
people out there, but I promise you that the large majority, you just didn't get the right treatment.
Yeah.
You got the quote unquote treatment, which was the injections, the pills. You did some physical therapy that told you not to move or do some light strengthening that isn't going to make any change. They gave you massage and hot pack and a TENS unit and a laser.
Everything temporary. Everything temporary. Yeah. And then, but you're thinking, hey, I did everything and nothing's changing. And they're like, well, no, you didn't do the thing that would actually change it, which is movement and strength. But yeah, when people get a nerve ablation, I don't like that. Yeah. It can't be undone, right?
Well, interestingly, it says nerves regenerate.
nerves can regenerate.
It also returns after 6 to 12 months.
But there's also redundancy built in your body too. So it's not like it's just one. Like your sciatic nerve is made up of about 5 other nerves or nerve roots that come together. So you could destroy one of them, but still have most of the sensations. Yeah. So there's redundancies built in the body. So then I have to assume, okay, nerve ablation, that's a scary thing. Spinal fusion. Again, it's one of those, it's not scary, it's unnecessary, and it's annoying when I hear it because now it's harder to treat the patient. They're locked at one or multiple levels that you can absolutely not change the mobility at. It's harder to change the strength at, if at all. And now you rely more heavily on the levels above and below to return your movement to normal. Yeah. Which leads to more instability and pain and overload and stuff like that. So it's not scary. It's scary. To me, it's like the end of the line. Well, but if that's the case, you'd be surprised. We just talked on an earlier podcast how there's so many people that they go to the doctor with, to speak generally, we'll say moderate symptoms. It's pain, it's been there for a while, but you're not having numbness and weakness down your leg, and it hasn't been there for 10 years, blah, blah, right? And the doctors, one of the first things they say is, we have to fuse these 2 levels. And you'd be surprised on how many people are like, all right, yeah, let's go. You would be surprised on how many people I've treated post-fusion, and I've asked, post back surgery. What did you have done? What did you have done? I don't know. Something. Yeah, doctor did something. Yeah. Was it fusion? I don't know. Was it a discectomy, a laminectomy? What was it? Kyphoplasty? I don't know. What levels? I don't know. Yeah, I mean, it is crazy to be willing to go through something and not even understand it. Not even understand it, right? Not understand what's being done, where, why. And I think a very scary treatment
is to go through all that, be there, and then the next phase was just, we're going to give you heavy pain.
And to me, I'm
For the rest of your life.
Yeah. So you know when you say like a nerve ablation,
Yeah.
for me, I'm looking at that over the, let's say, maybe 5 years of treatment that this patient got, and treatment we're putting in quotes.
Yeah.
By the time they've got the nerve ablation, very likely they've done multiple cortisone or epidurals, right? They've done medications, and then it would be muscle relaxers, nerve medications like gabapentin, stuff like that, Lyrica for nerve pain. They've done multiple physical therapy or chiropractor that hasn't worked. They've then likely gone through the process of getting some surgery, a discectomy, a laminectomy, or a fusion. All of this stuff hasn't worked, and now they're getting the nerve ablation, possibly setting them up for getting what's called a dorsal column stimulator, which is an internal device implanted to just, again, numb you to your symptoms. It's like an internal TENS unit. So when I see or hear nerve ablation, I look at it over the likely course that patient went through. So for me, that's scary.
Yeah, it sounds, the whole journey there, is kind of scary. And seeing someone starting on that journey.
It's tough.
Yeah.
It really is.
Yeah, you
It's
don't
tough to
walk
know
down
where
that
you,
road, yeah.
it's tough to know that the patient, as soon as they'll use some verbiage like, well, my doctor said, or it's
Yeah,
like,
I see where this is going.
I know where you're headed, and unfortunately, unless you want me to, I can't help. I think we covered a good amount of them. I'm sure there's more, and then there's more that are more for quote unquote internal conditions and stuff like that. The side of an appendix or something like that.
Sure.
But primarily, we're trying to speak more to the orthopedic side of things.
Yeah.
Of what is scary and what isn't.
Yeah, I think we cover quite a bit.
But I hope for the people listening to this that maybe helped a little bit too on to say, hey, what should I be concerned about? What shouldn't I be concerned about? If you're listening to this and you have some questions for home, go online, Instagram, TikTok, YouTube, send us some questions. If you want to consult, the spinaltruth.com to set up a consult or a session, either telehealth or in person. And hopefully we provided some information for you today.